Welcome, Bowman, and thank you for joining us in our Expert Corner interviews. We're excited to have you here.
Yeah, my pleasure. Thank you very much.
We're going to do a few questions, some personal, some on the science, some on advanced biometrics. We'll begin with, how did you come about in this industry? Like, how did you get an interest in this field?
Yeah, growing up in high school, I actually really was interested in venture capitalism, the idea of being on the science or the business side and being able to just learn about lots of different industries and invest. And my neighbor told me, don't just study business, study a technical skill. So engineering, science, something more hands-on or technical, and then study business so that you can apply that business to a specific field. And so I saw neuroscience major at the college I was going to go to, and I thought that sounds really interesting and technical. And so I studied neuroscience, and then I did a business minor at the same time, essentially with the hope of being on the business side of a science company. Mm-hmm. And then right out of college, I found the opportunity at Advanced BioMatrix, and it was exactly what I was looking for. At the time, it was a much smaller company. And I got to go in the lab and get my hands dirty, pulling the tendons out of rat tails, shaving the cowhide, and doing the science. And then at the same time, right when I was done with that, I would go and say, okay, now how can I start marketing these products? And it became really fulfilling to be able to say that, be a part of the whole process, start to finish, where I'm in the lab helping make the product. And then at the end of the day, I'm trying to figure out how to sell it. And so that, maybe I'm not in venture capitalism like that, 16-year-old vision, but it's really turned into this, it really fell down that path of, I'm exposed to lots of different sciences and technologies, and I'm doing it currently more on the business side. So it's been a great fit.
So more of an intimate view of, from the ground up, basically, of the company.
Yeah. And it's been beautiful being able to have helped make every single product that we offer, just to understand the logistics and some of the difficulties of making the product really translates into helping solve customers' problems when they're then using the product.
So Bowman, beyond your career and studies, I heard that you're an avid rock climber. Tell me more about this.
Yeah, my hobby that I found over the last couple of years has really been rock climbing, and either indoor, outdoor, and there's different types, bouldering and lead climbing, top roping. It's a mental challenge every day. I don't really like going to the gym and just trying to hit the weights. I kind of get bored easy. I like the variety. And so rock climbing just provides a new route and a new problem to solve every day. I also have 3 kids and 1 more on the way, and they're ages 5, 4, and 3. And so if they wake up before 6 o'clock, which they do almost every day, I throw them in the car with me and they take them to the climbing gym, and they scramble on the walls, and they've been starting to really get into rock climbing with me. So it's been my nice little kind of meditation, workout, family time, hobby to do, almost every day before work.
So much fun.
It's a blast.
Tell us more about Advanced BioMetrics, which is now a BICO company or part of the BICO company. I'm guessing there's quite the journey that was involved in getting there. Could you elaborate a little bit of some of the milestones that got you there?
Yeah. So when Advanced BioMatrix was founded, it was really founded on the core technology was type 1 collagen. And we started with 2 collagen products, a human collagen and a bovine collagen. And then from there, just started listening to the customers. Hey, we need higher concentrations. We want it in powder. We want it in, sponges. And so we started adding products, slowly over the years, just listening to the customers. And collagen being the main focus, because collagen is the most abundant protein in the human body. And all of our customers, in one way or the other, are trying to replicate the body in their research, in their experiments. So we started with collagen. We then started adding other extracellular matrix proteins like fibronectin, vitronectin, elastin, and just expanding our portfolio. And really this whole time, we're a private company, but profitable. We ran a really lean organization. We ended up growing to over 170 products with just 4 employees. And so you can just see, we focused on scalability and profitability, and we ran more quality control tests than any of our competitors, and just made sure we had the best product, but we ran it in a very efficient and lean way. So we started with collagen, we started growing, and then we really developed these, I'll say, 5 core technologies, where collagen being the foundation. We then started looking at how the substrate stiffness affects cells, looking at, cells grown on a really soft substrate will grow different than on a hard substrate. So we had a product line called CytoSoft that we introduced. So collagen, CytoSoft. We started looking at bioinks with 3D bioprinting using our collagen technology. So that was the third category. Tunable stiffness is kind of, CytoSoft, but more of a 3D, looking at hydrogels and 3D applications where we can make them soft or hard environments. And then we also acquired a technology called HiStem, which is hyaluronic acid. And that's the most abundant glycosaminoglycan in the body. So we developed this broad portfolio that covers a huge array of applications across the research community. And a year and a half ago or so, we started wanting to grow a little more aggressively and to really get these products into the market faster. And we feel like our products are really helping drive science forward. And BICO, we've engaged with previously Lifeink a lot in the past, and now called BICO. We've engaged with them, and we just saw this a perfect match where we can continue focusing on quality in these products, but being a part of a bigger organization that has, a bigger vision to really take our research materials and eventually get them into humans and really start actually saving and improving lives.
So when you're looking at all this, you're looking to solve primarily what is Advanced BioMatrix trying to solve specifically?
On the foundational level, we are trying to help researchers recreate the human body. And so if you are trying to do, as a researcher, we'll say drug screening, I want to know which drug kills this cancer cell. You want those cancer cells to first grow and act like they're in the body. And so you're going to grow those cells on our products so that they grow in the body, or as if they're in the body, so that when you're doing your drug screening, you can trust your results that, hey, when I go into the clinical trials or when I go into humans, the results I saw previously will translate into the results I get in clinical trials. Or if you're doing 3D bioprinting, you want to create a heart patch. Well, if you're trying to bioprint a heart patch, but you're using materials that aren't found in the body, your heart patch isn't truly a human heart patch, right? So we're trying to create these materials that when you're printing a certain tissue, you're actually printing that type of tissue. And there's a million other applications like that, but the core foundation is replicating the human body.
Full disclosure, we've been working with you since the very beginning. In fact, I think you were our first customer.
First customer, yeah.
Number one.
Yep.
A number of years ago, I remember them talking about it because I wasn't there at the moment that you guys were installed. Were you there when everything was installed? Yeah. Okay. I remember one of my first questions, because there's a number of companies that develop collagen and a number of products. So one of the things that I was thinking about, like what makes biometrics so unique that people want to purchase your product, it's the product itself and also attract a world-renowned company like BICO, right? So
yeah, quality, consistency, purity, and availability. So our The quality, if you look at, we run more quality control tests than any of our competitors. One of those tests for our collagens, collagen can be used to make a 3D hydrogel. And we actually use your instrument to look at the elastosense, to look at the gel stiffness of our hydrogels. So when we make new batches, we're confident that it's performing the same as previous batches. So that leads to quality and consistency. Purity is a big one. Our collagen is 99.9% pure collagen. So we've measured a lot of competitors that are 95, 90, 85% pure. And those contaminants can lead to variability in your experiments, especially if you don't know what those contaminants are. So we try to get all those out so that the researchers' experiments are consistent. And then another big thing is just availability. And we pride ourselves on not having back orders, having product on the shelf ready to go. So when customers need material, they get material. And so I think you put those four pieces together and it's a really powerful combination.
Indeed. I'm going to invite Demetria to join in. She has a number of questions for you, more specifically on the science and the different materials and their applications. And I think this section is going to be of great interest. And then we can go into some of your hobbies that we were talking about prior to doing this interview.
Sure.
So go ahead, Demetria.
Thank you, Kathleen, and thank you, Bowman, to be here with us today. So as Kathleen mentioned, I will make some questions more concerning the materials, production, development, and also applications. And so to start with, we know that Advanced now commercialize a lot of natural hydrogels, such as collagen, as we mentioned, gelatin, HA, polysaccharides, as well as some synthetics. I think I saw also some synthetics in your portfolio. And during the development of these many hydrogels, could you share with us which were your main targets? So you mentioned purity is for sure one, but do you also have some other points that you evaluate and you target, you have references values?
Yeah, it really depends on the material that we're working with. For a lot of our tunable stiffness products, like a methacrylated gelatin or hyaluronic acid, collagen, the degree of methacrylation, that reaction is actually what most customers are interested in. How can we get a high degree of methacrylation or just even a consistent degree? With our collagens, we're focused on purity. What steps in the process do we need to make sure we include to keep that level of purity? For our CytoSoft plates, we're measuring every single batch. And it's a silicone substrate of a very specific stiffness. And we measure every single batch to make sure the stiffness is exactly what we promote it to be. And so it really depends, on the material. And a more recent example, our Lifeink bioinks, we were supplying a 35 mg per mil pure collagen bioink. And we had some customers that said, we like the 35 mg per mil, but can you make it 70? Can you double the concentration? We want more robust tissues, or we want it to be more viscous. And so that was the goal, the target. And we went and, tinkered around in the lab for a couple months, and we're able to figure out the method to end up with a 70 mg per mil, very viscous, but really cool material, and solve that problem for them. And they're enjoying it right now. So it really depends on the product, what the goal is.
Yes, I understand. And actually, this was another question that I had to you about this it's a new product, right? The high concentrated collagen. Mm-hmm. And what are the main advantages of being highly concentrated for this one?
So the answer comes down to, again, replicating the human body. The concentration of collagen in the body is actually really high. And so this particular customer was wanting the high concentration because they're trying to essentially perfectly mimic the environment of the human body. So he said, the human body has a high concentration, so let's get that ink to be higher. And we did it. Some of the benefits that we can actually measure in our lab are, related to viscosity or rheology, but there's likely lots of other, cellular interactions and benefits with the matrix that maybe we're not measuring here in our lab, but all of the researchers doing all their experiments in their labs are actively measuring and studying. One of the weaknesses of our current model is we don't do a lot of kind of the cell culture studies in our lab. We do, I'll say, really basic cell application studies. And we've really relied on all of our collaborators, all of the thousands of customers that are experts in stem cells and neurons and fibroblasts and tissue models. We really relied on them as collaborators to publish beautiful data with their expertise and our materials. And we've really leveraged that expertise rather than us doing it in-house. And so a lot of those benefits we're going to start seeing over the next couple months as those publications start coming out.
Okay, I see. So you would say that 70 milligrams per ml is more or less a concentration of in the human body, or is at least closer than the
Closer.
Yeah,
a lot closer.
And so you mentioned that you don't do so much cell culture, but did you evaluated the cell viability in this collagen compared to
so the foundation of our testing is really cell viability and attachment. And from there, we're not looking at, stem cell differentiation or, kind of that next level, with antibodies, and we're not taking it to that next level yet.
But in terms of cell viability, they are also as good as for the lowest concentrated.
Yeah, and it depends a lot on applications and what cell types you're using.
Which cell type? Mm-hmm.
Right. Organoids are going to like a completely different matrix than fibroblasts, and cancer cells versus stem cells and neurons. They all love different matrices, different concentrations. How much the cell concentration that you use. There's so many variables to take into account that it's really hard to give an exact answer for what works and what doesn't.
Yeah, and just a curiosity, because when it's low concentrated, we observe a lot of shrinking when we have cells in the collagen, because the cells remodel the collagen. Do you expect also a shrinking with this high concentrated?
Fibroblasts love to just chew up and remodel collagen. And so the higher the concentration, the less that we see it. But that's always an issue. And it's, how can we allow the cells to remodel that matrix and turn it into real tissue before the whole tissue is chewed up or collapsed or anything like that. So there's certainly a balance, and that's one of the struggles in the bioprinting field right now, because we're never going to print the exact tissue. It's really, we're printing the scaffold and putting the cells in there and allowing the cells to then turn it into a living tissue. And that's one of the hurdles and one of the things being studied right now in bioprinting that we're just excited to be a part of.
Mm-hmm. And do you expect that the printability of this one can also be higher because it's more concentrated, it's more stiff, let's say?
Yeah, there's different types of printing. If you try to print it on just directly onto a glass slide, the more viscous it is, the better for keeping it from kind of oozing. If you're doing fresh printing with a support bath, then there's not a huge difference between the 35 and the 70 mg per mil, because they stay right where they're printed anyways.
Okay. And okay, so I will come back a little bit to the initial question when I was talking about the development of the hydrogels. So you mentioned it depends. The purity is for sure something that it's common in all your portfolio. And which are the techniques assays that you normally use so during the product development for assessing purity, biocompatibility, mechanical properties?
Yeah, so we'll just start with our collagen products. So for purity, we'll look at an SDS page electrophoresis, the Kamasi blue, just make sure that there's not other components in there. And then we'll do a silver stain to actually quantify the purity of collagen. So we'll do those on every single lot that we produce. We'll do fibrinogenesis to look at the actual gelation. We use the ElastoSense from your company to look at the gel stiffness. We'll do endotoxin testing, bioburden, amino acid analysis. We do a 2-week sterility test. What else do we do? That's about it. But actually, okay, we do pH, osmolarity, and there's a whole bunch of other in-process tests we do as well. But those are kind of the core technologies, and that's just for the collagen. So all the other products have different tests. So, photogel, the methacrylated gelatin, we do an NMR to look at the degree of methacrylation. For high stem, we do a TNBSA assay to look at the degree of thiolation. And with the bioinks, we're measuring protein concentration, we're measuring purity, lots of the similar tests that we do on the collagen. So every product has kind of this specific portfolio of tests specific to that particular product and what our customers really need to know for that material.
Okay, so I believe that they are both for product development, but also for quality control, right?
Yeah.
Okay. And so for the natural hydrogels that you have, I saw that you work with a number of techniques to obtain them, such as extracting from a natural source. But for the human hydrogels, I saw that you also work with techniques where you have a cell culture and you make the cells produce the collagen. Is that right?
Yeah, so our vitriol, our human collagen, we grow out fibroblast cells that will naturally spit out or secrete the human collagen. And after various months of that, we can then purify out the collagen from that, from the media that the cells are in. So we isolate all that collagen, purify out all the other goodies that the cells spit out, and we end up with the highly purified type 1 collagen. So we're not getting it, we're not getting it from human skin or anything. It's from a cell bank, fibroblast cells.
Okay, so the only way that you produce the human collagen is from the cells? You don't, okay. And just to have an idea, how long does this process take from since the beginning that you start the cell culture to have the collagen purified?
For that particular process, it's about 6 months.
And what are the main challenges of this process, if you can share with us?
Keeping cells alive for a long period of time in a sterile, aseptic environment, and then encouraging them to spit out lots and lots and lots of collagen. And then at that point, when you're done, you then still have to go through the whole purification process, which is similar to our other collagens, but that still takes time as well. So it's just a long, tedious process.
That's very impressive. And so you also have natural hydrogels that are photo cross-linkable, right? And could you share a bit with us the importance of this feature?
So the tunable stiffness products really fall in line with the mission of recreating the human body. If you are working on neurons and brain tissue, you're going to have and want an environment around 0.5 kilopascals, just really soft. If you're working on cartilage or bone or heart muscle, you want it 10 to 100 kilopascals, just significantly different environments. And if you're exposing chondrocytes to a really soft environment, they're going to act different than if you're exposing them to a really hard environment. Another concept is with bioprinting, for example, you need to cross-link some of these materials just to be able to, if you want to transplant something or move something, there just needs to be this extra level of strength to be able to actually handle or manipulate the materials. If you're trying to make an organ on a chip type of disc or slide, you just need to be able to cross-link and manipulate the materials. Another feature is biodegradability. If you're doing an implant into the body and you want it to last longer, you can cross-link it longer. if you're looking at controlled drug release for a drug delivery tool, something that's lightly cross-linked versus more cross-linked will have very different porosities and will release that drug or those cells at different rates in the body. And so the tunability can be for a wide variety of applications, but we've found that it's a very exciting product, and all of those materials are growing quite rapidly as researchers are finding new ways to take advantage of that cross-linkability and tunability of those hydrogels.
Yeah, it's great. It's good because the researcher can have more control over their sample, right? And did you notice expressive loss in cell viability because of this modification compared to the natural hydrogels without the photosensitive groups?
Yeah, the biggest hurdle with the photo cross-linking is, if you're using UV light, you're exposing your cells to UV. So there's different ways to get around that. Some applications don't even use cells, more of these engineering or scaffold-based applications, they're not using cells. So they're zapping these materials for as long as they want. They don't really care. They'll rinse them afterwards, then they add the cells. The other option is to use a more friendly cross-linker, photoinitiator, or light source. So instead of using ErgoCure with UV light, a lot of customers are switching towards LAP with blue light or ruthenium with 400 to 450 nanometer light. And so your cells are just being exposed to a visible light instead of UV, and actually a more friendly photoinitiator as well. Anytime that you're exposing your cells to high intensity lights or high heats or just different environments that they're not used to, you run a risk of damaging them, altering the DNA, or doing something to them. But there are workarounds that are showing to be quite effective in mitigating that risk.
And I think you briefly mentioned also about the stability of these hydrogels. They are more stable, I would say, over time than the ones without the modifications. If we move a little bit more in details about mechanical properties, you mentioned that it's very important in your context because we know that cells behave differently depending on the stiffness. And you also mentioned that you use the elastosens to measure, but do you have other techniques also that you work with to measure the mechanical properties?
So we use a Bowman rheometer as well, but the elastosens actually has become our favorite machine, not just because you're interviewing me right now. We are using it for just so many tests. So right now we have an ongoing.
We volunteered for these interviews.
I'm not a paid actor. So a lot of we're doing a big study right now where all of our cross-linkable materials, so we have methacrylated collagen, gelatin, hyaluronic acid, alginate, dextran, all of those materials, and PEGDA, we're testing all of those materials on the elastosens using LAP as the photoinitiator and 405 nanometer light. And we're looking at cross-linking them for a set amount of time to see how fast it gels, how strong it gels. And then we're looking at different concentrations. And so we're compiling this large white paper with all of our materials with multiple parameters and trying to just give the customer as much data as we can to kind of provide benchmarks. And we understand that every customer is going to be using different concentrations, different light intensities, different cross-linking times, different machines, everything's different, but we're just hoping to paint a story and provide the data that we can to say, hey, these are the benchmarks, this is the benchmark, build off of it. Use this to hopefully this data gives you a leg up so that you can, start at a better spot and have at least a basic understanding to, give you a better chance of success in your studies. And we're using the elastosens rheometer for all those studies. And we're really excited to share that data once we compile it all and finish all these tests.
So really establishing a foundation for everyone so that they can build from something that's really solid.
Exactly. And, looking at all of our competitors out there, nobody is talking about rheology when it comes to hydrogels. It's, hey, here's a 4 mg per mil rat tail collagen, good luck, use it. And what we're saying is, here's our 4 mg per mil rat cell collagen. The stiffness of this, if you follow our protocol, should be around 2,000 pascals. And so it's like, okay, if I want something softer, I'll dilute it to lower concentration, or maybe that's not quite high enough. Maybe I should be thinking about a 6 mg per mil or 8 mg per mil hydrogel. And so just we're trying to present this data to our researchers and just incite and encourage them to ask those questions, because it's a lot less expensive to ask the question and buy the right material than to ignore the question and have to do multiple studies until you find the right product.
Indeed.
Yes, totally. It helps a lot already. We jump a big step in the research if we already know some parameters in advance. And do you also measure properties of, so we are talking about bulk hydrogels, right? But do you also measure formed hydrogels or scaffolds?
We don't have a good machine for measuring, like kind of tensile strength of a cross-linked scaffold or a bioprinted construct. We haven't dove into that yet.
Okay. Yeah, I have one curiosity. Do you know if your products are being used in vivo studies? I imagine yes, but do you know some of them?
Yeah, I can't really name any off the top of my head, but I know that a large portion of our customers are doing animal studies with our materials right now. Using, some customers are using our Lifeink bioinks as actually a drug carrier or cell delivery device into animals for various animal models. High stem, I know, has been widely used in various animal studies, and we have collagen sponges that have been used for evaluating creating new cartilage for knee implants. And so ABM currently is focused on this research community, but we are, now that we have this broad foundation of applications for all of our products and a huge user base, we're now evaluating that next step of creating some of these materials under GMP to then enable human clinical trials and start translating this in vitro research, which has now turned into animal research, and enabling researchers to now turn that into human use applications and trying to find ways to take that next step in really solving real world problems and improving lives.
Before Elastosense, do you remember having facing some challenges when measuring the mechanical properties?
So when we bought the Elastosense, it was kind of around the time that the substrate stiffness started becoming really popular and people started asking that question. And so before then, we weren't actually really measuring it. We were looking at fibrinogenesis and the purity, and we were doing all those other tests, but we weren't really even aware of the importance of stiffness until some publications came out at, I believe, UCSD that really started introducing substrate stiffness as an important characteristic, and mechanotransduction and these other principles. And because of, we started getting these calls from customers, hey, what's the stiffness of your hydrogels? That's why we then worked with you and got that instrument to start addressing those customer questions. And it's just been a fantastic tool, because almost every single day that type of question comes up, and we're happy that we're able to address it, and we're looking forward to being able to address it for a broader portfolio of all of our tunable stiffness products and the photo cross-linkable materials. And it's just become a great tool because customers are seeing the importance of it.
So what is a day in the life of Bowman Bagley? Tell us a bit about your typical workday.
Day in the life of Bowman at Advanced BioMatrix. That's a great question. What I love about working here is that every day is different. There's not a rigid routine. We're managing about 200 different products right now, and every product, like I said earlier, we try to make it as big as possible, as many units as possible, so you can make it as infrequently as possible, which is kind of a secret to running a very lean operation. And so, next week we're bringing in a cowhide, and I am going to go help, shave the hair off the hide and the fats, and help with that process. Which it's dirty, but it's just it's infrequent, but that's fun. It helps you understand the process better. And some days it's more focused a little bit on marketing and this, working with the sales team. How can we tell more people about our materials? How can we highlight the mechanical testing that we're doing on these products? How can we support our distributors so that they are engaged with their customers and can provide the support and feedback? Other days it's looking at, the ElastiSense. Hey, what can we use with that machine? What tools, how can we use that machine to better support our customers? What are our customers asking us for? And so every day it's a little bit different, but I would argue the summary is it's very customer focused. Do our customers need a new product? And if so, let's work on developing it. Do they need more quality control tests or more data? Then let's provide that for them. Do they need to just know about materials? Okay, let's create that marketing. Does our website need to have different functionality? It's a little bit everything. And I love that it combines my science background to be able to address the new products with my business background to be able to promote those products. And it's a beautiful mixture of both. And I feel very blessed and fortunate to be able to use and address both sides of the equation every single day.
Indeed. So then, if you were to give your younger self some advice, what would you give yourself advice on?
That's the easiest question. I would give my younger self advice to do a more hands-on degree at college. So I studied neuroscience, which was amazing and highly detailed, and I just learned so much and I loved it. But there weren't any really hands-on projects. I wasn't able to code an app and then show what I have learned. I wasn't able, engineering, I didn't get to build a printer or a device and then, kind of prove what I've learned or turn that knowledge into a product or a material. Neuroscience was just fill your mind with as much knowledge as you can in the hope, most of those students were going to med school. And I knew I wasn't going to med school. So I learned a lot, but it didn't translate into as much as I had hoped. And so a hands-on type of engineering or building degree, I think lays a great foundation for just learning how to create and learning, truly learning a subject.
You were ready for that question.
I've answered that. I've every time we have an intern come in that's, like a high school intern that's trying to decide on their major for college, they say, what advice do you have for choosing a major? That's the advice I have. I said, find something.
That happens to be my next question, actually.
Yeah.
It's really, I'm sorry, go ahead.
No, you can ask the question.
No, it was more of what would you suggest students listening to this interview, starting out in the field of, in the biomedical field, like what kind of advice would you give them?
Yeah, every high school intern that comes in or just wants to learn about our facility, we're really open about giving tours and just talking to them and showing them this piece of the industry. And they ask that question and I say the same thing. Find a degree that you can build something and show what you've learned. If you're interested in biomedical, find a biomedical engineering. If you're interested in computer, make sure it's an engineering, so you're building and creating.
So as the managing director of Advanced BioMatrix, how do you keep your team motivated? How do you remain motivated? And you can answer that either prior to COVID to existing times with COVID.
It doesn't matter when. We're trying to promote ingenuity. We want to give our employees this flexibility to where they don't have to feel like they're stuck in a box. We have protocols that we follow, but if they can think of a better way to do something, then we want them to speak up and say that, hey, we can figure out a way to scale this up, or we can do this in 1 day instead of 3 days by changing up this step. And we recently, there was a process that was taking 2 people 2 hours to do. And we looked at it for a little bit and we said, wait, if we switch this one filter, one person can do that whole step in 10 minutes. And so we saved 4 hours of production time. And that's the type of ingenuity and creativity we want to promote. Just if you can think about a better way to do it, let's give you the time of day and hear you out, and let's see if we can do it. And over the last couple of years, there's been hundreds of these little changes that have really just dramatically improved our efficiency and productivity and quality.
So you've sort of removed the hierarchy of an industry so that when you keep it flat, you're able to take in all the ideas from everyone, regardless of their position, and really listen to them to finding the best solution.
Yeah, one of my pet peeves is when, if there's a manager that's saying how something should be done, but has never actually made that product before, how do they know that that's the way it should be done? They don't know the pain points. The people making the product very well, they know the pain points. They know what they don't like to do, and they know that there's probably a better way to do it, and they're the ones that are going to find it. And so giving those people the voice and the power to address those issues, I think, is one of our keys to success.
What are you doing to try to attract talent to your team?
So my first step before I hire someone is, let's try to first make everything more efficient. Obviously I'm not trying to kill my employees, but there's all these steps where if we can make them more efficient, we're going to have more time and everyone's going to be able to learn more and do more. So eventually we'll have to hire more, but our goal for the next 6 months is we're not focused on more people. We're focused on laying the correct foundation for all these materials, so that we can then hire people and we can do everything right and efficiently and scaled up.
So what are the emerging challenges and trends in the field? This is a broad question, not a very specific.
Yeah, which field? Because our products
our field, right?
I mean, our products are used in, I tried to summarize how our products are being used, like which applications, by just searching through publications. And the first 20 publications I went through had about 20 different applications for 20 different unique fields of use. But in terms of maybe tissue engineering and bioprinting, I think one of the challenges is obviously how can we create a tissue or some sort of organ that can be close enough to a real human tissue and organ so that it can be transplanted, not rejected, and do the function it's supposed to do for an extended period of time. And there's lots of groups trying to address all those different factors. And it's going to be a beautiful day when all those come together, but it's going to require a fascinating collaboration among industries with different types of bioprinting techniques, different types of cell perfusion, medias, and bringing all of that experience and expertise together and into one group to then eventually create a functioning, living, implantable tissue or organ that truly will save lives. And I know, and BICO's vision is that's what they're trying to do right now. They're trying to bring all these different tools and techniques under the same roof so that we can all work together towards that goal. But on a broader sense, it's going to require even broader and wider collaboration amongst industries and experts to get there. But we're seeing it happen right now, and it's really fun to be a part of it.
And so how do you see then Advanced BioMatrix in the next 5 to 10 years? I mean, I don't know if you can look into your crystal ball in that way, but what do you envision?
We are envisioning Advanced BioMatrix continuing to be this world leader in biomaterials. We are not experts in machinery and printers, but we are experts in the biomaterials. And so we're going to continue to expand our portfolio to address all the different growing applications and different types of printing and tissue engineering. And so that's one segment. The next segment is creating a material that is GMP, ISO certified, that can go into humans. And so we'll combine this really high quality, amazing materials with something that can be used in humans. And so in 5 to 10 years, we're hoping that our company has shifted from helping researchers to helping patients.
Great. You mentioned once, or it was quoted that to push the world of 3D cell culture, that you're there to push the world of 3D cell culture. What did you mean by that?
The vision behind that quote is there's still a huge portion of people doing 2D cell culture. And the body is not 2D. The body is 3D. And so we need to help get researchers into that 3D realm, which has thousands of additional variables and hurdles and challenges, but that is the next step towards getting things that can save human lives, are 3D models and 3D tissues, etc.
Thanks, Bowman, for joining us today and for sharing your experience and your knowledge and your expertise with all of us. We really appreciate your time and collaborating with you and everything that you've shared with us today. Thanks.
My pleasure.
Thank
And
you.
we're looking forward to the years ahead with using your machines and collaborating further.
Indeed. Thank you.
Okay,
Thank
thanks.
you.
Have a good day.